Okay, part 17 of the book, Prevent and Reverse Afib and CHF by me, Pete Rogers. We're on page 75. What we're talking about here is atherosclerosis, okay? And if you've seen me before, you probably heard me talk about this before, but if you haven't seen me, here's a big academic orgasm secret for you. Atherosclerosis is a blood clot, and you need to know that. Medical students, doctors, they don't know that. 99.9% of all doctors, including the Harvard ones, they don't know that. Once you understand that atherosclerosis is a blood clot, that concept just makes it easy to understand everything else. So what does that mean? Anything that causes the blood to be more prone to clotting makes you more prone to atherosclerosis. So how do you avoid it? You avoid the stuff that causes atherosclerosis. The other thing I'm going to tell you is you should use logic, okay? And I realize people freak out when you say that, but it's the truth. Because I see people, they ask me all kinds of stupid questions. They're like, well, I heard nuts are good for you. Look, we know that high-fat diets, elevated triglycerides, chylomicrons, LDL cholesterol, they're all going to cause more red blood cells sticking together, more rouleau formation, also called more blood sludge. So how could nuts be good for you? They're like 80 to 90% fat. It's fat, okay? And the sat fat from nuts is like sat fat from an animal. It's bad for you. It's atherogenic. Okay, and olive oil, extra virgin olive oil, like it's going to, please you in bed or something. BS. It's liquid fat, and it's got a lot of sat fat in there, 11 to 14%. It's got a lot of PUFA in there, polyunsaturated fatty acid, primarily omega-6. That's all atherogenic. It's all bad. All the cooking oils are bad, okay? Coconut oil is bad, all the sat fat. All right, other things that are prothrombotic, smoking tobacco, raises your hematocrit is one thing that it does. Vasoconstrictor is another thing it does. Leaky gut causing amyloid clotting. Infections themselves are atherogenic. Diabetes, damaged endothelium. Just being fat, you're going to have more fat spillage into your blood. You're more likely to have hypertension, for example, more likely to be diabetic. Elevated serum uric acid from, excess alcohol, excess high fructose corn syrup, severe dehydration. Excessive stress causes hyperlipidemia, same with sleep deprivation and caffeine. Toxins can cause some of the above problems. Can atherosclerosis be reversed? Yeah, of course. Why do you think I'm talking about it? Okay. The acute clot's easy to reabsorb. The lipid core can be reabsorbed. The necrotic core can be reabsorbed. So here's what a plaque looks like. Basically, you've got the acute clot. We usually don't see too much of that. What we see more typically is a necrotic core, dead tissue, lipid core meaning fat tissue. And then you get fibrous tissue. The fibrous tissue, once it's acellular, you're not going to reabsorb that. But while it's still got some cells in it, you might reabsorb that. Calcification. People are writing about claiming they can partially demineralize the calcification. I haven't seen it yet, so I'll believe it when I actually see it. But the good news is you can shrink the plaques. They've got films of these. Esselstyn and McDougall saw it, etc. Most patients don't want to do the diet, but the few that do can make tremendous progress. And you'll also, once you start eating healthy and avoiding all the things that inhibit endothelial nitric oxide, like the high-fat diets and the high-sodium diets, the endothelial cells, the arterial lining cells are called endothelial cells, will start making nitric oxide vasodilator again, which is also antithrombotic, okay? Helps prevent platelets from clotting. These EPCs are endothelial precursor cells that circulate in the blood, and they cover the clot when it forms on the wall. And by the way, that's how it gets subendothelial, because these guys cover it. Endothelial precursor cells. You don't need the elaborate hand-waving arguments of conventional medicine. And who figured this all out? The pathologist. I talked about this before. When I was a young guy, I was trained in vascular interventional radiology, imaging-guided surgery, and I thought myself, peripheral vascular surgeons, cardiovascular surgeons, cardiologists, we were the experts on atherosclerosis. But it turns out the real experts are these pathologist guys, and they've known since around 1860s that it was a blood clot. You just look at it under a microscope. And the pathologists, they don't have any dog in the fight, okay? A cardiologist can't criticize stents. That's their money. Okay, a surgeon can't criticize surgery. That's their money. All their colleagues will, boot them out of the society, all right? But pathologist doesn't care how you treat it. He just looks under a microscope and says it's a blood clot, like a hematoma. The immune system comes in and tries to reabsorb it. That's what you have in the arterial wall. Okay, Ansel Keys was a good scientist showing elevated blood cholesterol causes atherosclerosis, okay? And you know that if you just eat the low-fat vegan diet, starch-based, less than 10% of calories from fat, That's the most effective thing you could do to avoid getting atherosclerosis. Caldwell-Esselstyn's shown that. Other studies have, been consistent with that. The Blankenhorn work, the Pritikin's work, Kempner's work, the Armstrong animal studies, etc. Okay. William Roberts showed that it's always diffuse. It's never a single vessel coronary artery disease. Gregory Sloop, the other great pathologist, the pioneer of the atherothrombosis theory, he showed it was atherosclerosis. He looked at it under a microscope plenty of times. I spoke to him on the phone. Okay, paleo, keto, low-carb carnivore is just stupid. It's just a trick for the pros. Here's a paper by William C. Roberts. The quantitative extent of atherosclerosis plaque in the major epicardial coronary arteries in patients with fatal coronary artery disease. From endarterectomy specimens also. Okay. All right, so what did he learn? He learned that cardiac cath estimates the amount of disease because it measures. Cardiac cath, what you do is you look at the image and you see how stenotic is it, for example, in this location. Let's say in this location, but you're comparing it to an adjacent area that's also a disease because it's always diffuse. So the cardiac cath underestimates the severity of the narrowing, the severity of the stenosis. Okay. And what Dr. William Roberts saw after, doing autopsies on thousands of these patients and looking carefully at the coronary arteries, they call it quantitative because they would, cut it into little 5-millimeter segments so they can assess it all the way up and down the different, major epicardial coronaries. Those are the big ones on the outside of the heart. Which means the typical ones you hear about: left main, LAD, left anterior descending, left circumflex, and right coronary artery. So here it is, William Roberts' famous quote: single vessel coronary artery disease is a myth. It's always diffuse, always diffuse, always diffuse. You need to know that. What that means is you can never conclusively fix it with a stent or with a open heart surgery because it's always diffuse. They can't even tell which one's going to progress. So here's an example, like along the lines of what they did. They just chopped it into 5-millimeter segments and then assessed the amount of stenosis in each segment. And that way they had a quantitative assessment of it. Okay, these are each 5-millimeter increments in length. A rather brilliant way to do it that he figured out after being, the big dog in cardiac pathology for 50 years. Okay, and like I said, he says it's always diffuse. All right. That was his legacy paper as he's getting older. Most of it is fibrous tissue because it's, it's like a healing scar. Fibrosis comes and replaces it with collagen being laid down. In an acute clot, you'll see more acute thrombus. Okay, in a chronic clot, you'll see more of this fibrous material. You'll see recanalization channels as one sees with a blood clot and pulmonary emboli. Okay. Oh, the other thing I wanted to mention that's not often mentioned is that poor dentition increases your risk of coronary arteries, especially if you got like a root canal, you got a jaw infection adjacent to it at the root tips. You could be seeding the blood with prothrombotic bacteria. If you just have gingivitis, one of these things, you could also be seeding the blood with prothrombotic bacteria. So you want to take good care of your mouth, and if nothing else explains what's going on, consider that it's a tooth problem, especially if you've had a previous root canal. So anyways, that's the big stuff I wanted to tell you. The biggest point of this lecture today was just that atherosclerosis is a blood clot. Remember that, and you'll understand. You'll be able to make sense out of all kinds of things with atherosclerosis. And so you want to avoid things that cause clotting. And atherosclerosis causing narrowing and hypoxia of the tissue, lack of oxygen delivery, that'll increase the risk of cancer. That'll favor a tumor microenvironment that's pro-cancer growth rather than pro-normal tissue health. So anyways, that's it for today. Hope you found that helpful.